So I just suctioned the trach of this patient. I assessed their respirations, their O2, their collar, respiratory effort and rate. They've been pre-oxygenating. I'm gonna come in, I'm gonna put on my PPE, so I'm gonna put on my goggles, my mask, my gown, and put on my clean gloves. They are in semi-fowlers and they have a pad over them. I'm gonna remove my oxygen. I'm gonna hold my faceplate and my outer cannula, and I'm gonna remove the old inner cannula, and I don't have one, so I'm just gonna pretend it's in my hand, and I'm gonna throw this into the red bag. I'm gonna do hand hygiene, and I'm gonna put on my sterile gloves. I used these before, so they're kind of wonky. Okay, so I've got one on. I'm gonna grab the other one. Okay, so I've got both my sterile gloves on. I'm gonna grab my sterile tray. And I would take out a new cannula and put a cannula in now, but I don't have one, so I would stabilize it and put in the new cannula. So this hand would be contaminated. So I'm gonna grab my supplies. And I don't have sterile saline in my kit or sterile peroxide. So I'm just gonna pretend that this saline is sterile. I'm gonna pour that into the 2 compartments and then pour in peroxide into the 2 compartments. So once I have my peroxide and my saline poured, I'm gonna take my cotton tip applicators and put it in my peroxide. I'm gonna go underneath the faceplate and do 1 swipe and get rid of it. 1 swipe under the top of the faceplate, underneath the top of the faceplate, and get rid of it. And then if I had more applicators, I would take the applicator and put it in the saline and wipe it off the best that I can. But I don't have any. Then I would take the gauze and I would dry and get rid of that. Then I'm going to take the trach dressing, trying to keep it as sterile as I can, and put that underneath the faceplate. Okay, and then I would get rid of my sterile gloves because I don't need them anymore. And put on clean gloves. Then I would take my tie. I would do the one nurse method since there's just me. I would tie it and tie it on this side, secure it. And then once that was secured, I'm for sure that's secured, I would take off the old ties. I'm going to do another assessment, look at my O2, listen to lung sounds, look at respiratory effort and rate, and then I would remove my PPE, dispose of all my supplies, and document what I did.